Hey, I'm Dr. Simeone with the Disc Chiropractic, and I wanted to take a moment to answer a handful of questions related to muscle spasms. The first question that I commonly get is, why do muscle spasms happen more with age or as someone ages? Now that's primarily due to the fact that as people age, they tend to lose muscle mass, and at the same time, it leads their nerves to be more sensitive, and so they're more likely to have an overstimulation that causes muscles to fire and eventually spasm. Another question that I get is, how do I know if it's a muscle spasm or a nerve issue? That's a really good question. So if it's a nerve issue, the muscle spasm will typically occur alongside another symptom like numbness or tingling, could be pain that's traveling into the arm or into the leg, and it could be also like a burning feeling as well that's typically traveling into an arm or leg. And how do you treat muscle spasms? Now that's a great question. There are a variety of different things that you can do at home, of course, making sure that you're well hydrated, taking multi minerals that can also help to make sure that your body has oftentimes the minerals that people are missing. And it also helps your body to retain more of that fluid to keep you hydrated. And the other thing that we would do in our office for us to treat somebody would be looking at things like therapeutic exercises that specifically target the area where the muscle spasms are occurring, as well as shockwave therapy, which uses acoustic sound waves to basically melt away scar tissue, damaged tissue, but also trigger points and muscle spasms. And then another therapy that we also use would be soft tissue therapy. And so that's another therapy that's a bit more superficial to work on the superficial muscles as well. Now the chiropractic adjustments play a big role because oftentimes the muscles are spasming due to a structural imbalance in the spine. So that of course is another way to help treat muscle spasms.